Hey Lillian, do you find it's getting harder and harder to get into a conversation about the current pandemic outside of school, work, in daily conversations?
Yeah, I see what you mean. Everyone seems to be so numb and tired from hearing about the pandemic, but not talking about it isn't going to make it go away.
And it's not like we're not affected by it. I mean, young adults have some of the highest rates of infections.
We're affected by the pandemic, but it's really hard to get our voices heard. I wish there was a platform or some kind of resource we could use so we can help spark conversations about health.
Right. It's obviously not enough that the two of us are having conversations about health. We are only two people. We can talk until we're blue in the face and still gets nothing done. How do we get other people to join the conversation? My question is, how do we engage more young health leaders?
The way I see it, I think the problem is that young people don't think about health until we are affected or until our loved ones are affected.
Right. And especially since we're generally healthier.
The thing is, we can't wait for people to get sick before they start thinking about health. We have to start now.
I know, but how?
I mean, we're having conversations about health right now, aren't we? How do we start our conversations?
Well, for me, it was a lot easier to talk about health when there was relevant information I could easily share with friends. If the information is easy to digest and visually appealing, that's a plus.
Right. Making the content engaging and relatable, that's important. I've always thought that the health information we see online on a day to day basis is like hearing an announcement on the PA system. I'll hear the message, but I'm not paying attention to it unless I hear something that speaks to me on a personal level.
So, how do we make health messages relevant to youth?
Well, I think the content has to be bite-sized and easily digested. I'll be the first to admit that I don't have a long attention span. I'll scroll through a web page for maybe 5 seconds, and if I don't see the information I need, I'll move on. There's just too much information online and not enough time to consume it all.
Right, same here. I watch movies at 1.5 times speed.
Oh, who doesn't these days?
So, we need Dr. Henry to talk at 1.5 times speed.
Uh, you can hang on to that idea. What I was trying to say was, I only want to see the most important summaries.
Right. But beyond how the information is presented, though, I also think adding more context would be helpful. Young people know that staying at home keeps our grandparents safe, but it's really easy to forget that human connection when we only see numbers every day.
Yeah, we need to know the numbers and the facts, but evidence alone doesn't actually convince people to change their behavior.
hmm For example, when people I know share health information along with their own stories, I connect with it more. The issue feels more important because it affects real people I know.
Yeah, and for me, hearing other people's lived experiences shows me that I'm not alone in feeling stressed, anxious, or sad sometimes. It's reassuring to know that we're all in this together.
Right. It's great to have facts and serious information to share with people, but you can't always be that one person talking about restrictions, rules, lockdown, etc.
Yeah, I wouldn't like you much if that's all you talked about.
But imagine if we had something quick, funny, and relevant to share.
So, you mean like a meme?
Right, exactly like memes, which is humorous content that gets shared rapidly on digital platforms. Sharing a laugh can help you feel more connected to friends, and it can be a great conversation starter.
Okay, then it sounds to me like social media is the perfect platform for our conversations. They're specifically designed to bring short, eye-catching, and digestible content from people you care about directly to you.
And it also helps that social media is already a huge part of people's lives. I don't know about you, but I scroll through social media mindlessly all the time.
Me too. But yeah, I see what you mean. Now that I think about it, social media is a huge source of information for me. I'm also a lot more comfortable speaking up and sharing my story on a digital platform. And when I follow influencers on social media, people I admire and respect, and they share something, I pay more attention to it, and so do millions of other young people.
Right. And let's be real, with all due respect, who is going to be more effective in telling me to stay home? My celebrity crush or the Ministry of Health?
Well, I think we all know the answer to that one.
All right, all jokes aside, social media is great for starting conversations as long as we're careful about sharing credible information and preventing misinformation.
Yeah, and young people are leaders in the digital world. We can disseminate information, engage in discussions, and participate in response efforts. With the right tools, we can spark conversation and incite change.
So,
So,
what?
what conversations have we been having online?
Well, Lillian creates art on Instagram to raise funds to support the Canadian Mental Health Association.
And Tina is hosting a contest that acts as a platform for youth to share their lived experience during this pandemic.
And tonight, we're fortunate to continue the conversation here at Health Talks with all of you in the room.
The point we really want to emphasize tonight is that youth leadership can take all kinds of different forms, platforms, and scales. We can start on a scale as small as the individual, and with the help of social media, the discussion can spread throughout the world.
All it takes is for one person to start one conversation.
Transforming an announcement into a conversation can sound daunting. We really need to create relatable content, facilitate two-way conversation, and understand the needs and priorities of young people.
At the end of the day, the key to turn knowledge into actions in healthcare is the willingness to engage youth in program development, implementation, and evaluation.
Our hope for healthcare is a future where we leverage the power of social media to build health conversations, just like this one, into the lives of young people. And we want to get your help to make it happen.
As you close the Health Talks window today, we challenge you to start the conversation. You never know what your conversation may evolve into. Thank you.